phone line instead of that, because I don't think it actually sends the audio to this. Have we done it before where it sends the audio to the TV? I don't know. I think it's just the screen view.
Thought it did the other day, but maybe not.
When we did it with the hospital, we used the call-in for the audio.
Okay. Well, we have to avoid that.
Rob, how's it looking there? Are you getting that done? Getting set up?
Well, we're going to try it. I can't get the sound to come out of the screen, the large screen. It's just coming out of the laptop. And we have a few people around the room, so I'm hoping we're going to be able to hear. When you're ready, we'll start. If we could do, everything by roll call, including introductions
Okay.
and any votes.
Okay. Okay. We'll do the best we can with this. So let's go ahead and call the meeting to order then, because it's 3 o'clock. I think it would be a good idea to go around and kind of indicate all who's here. What I can do is I can go through, I'm working from my phone today, so be patient with me, guys, because I might miss folks, but I'm going to try my best. So particularly with Crystal in the room, Crystal can capture who else is all there too. So when I call your name, or at least the name that I'm seeing on your screen, please let us know who you are and what county you're from. We'll start with Heather. Hi, Heather.
Hi, Heather Adams, Wendell, Washington County.
And I see Belinda next.
Belinda Bradley, Warren County.
Michelle. Oh, unmute.
Michelle Burke, Washington County.
Thank you. And I see Maureen. You got to unmute you, Maureen. Oops, I lost her.
Maureen Schmidt, Warren County.
Thank you. Then I see Tammy.
Tammy DeLorme, Washington County.
Holly.
Holly Arian, Warren County.
Rob, do you want to introduce everybody that's in the room there?
Sure. So it's Rob York, Director of Community Services, and then we'll go around the table here.
Harry Wright, Office of Community Services.
Harry Carlson, Office of Community Services.
Barry Murphy, Washington County. Joan Grushback, Warren County.
Excellent. Thanks, guys. And then we have David Rossetti's joining us.
Hi, David Rossetti from Northern Rivers.
Hi, David. Paul?
Paul Seneca from Glens Falls Hospital.
Hi, Paul. I have you there as a Cole.
Hi, Liz Cole from BHSN. I'm currently coming in for the behavioral services for Warren, Washington County.
So that's Elizabeth.
Also here as well.
Elizabeth Cole, right? Okay.
Yes.
Okay. I always see that and I think of the French word for a Cole. School. Okay. So, okay. Karen, Carl?
Hi, Karen Carl from the Addictions Care Center of Albany.
Hello. And then I have Kay Stack.
Yeah, Keith Stack with the Addictions Care Center of Albany.
Hi, Keith. Jim?
Jim Dexter, Warren County. I get that mixed up every once in a while.
Keeping it straight.
I work in one county and live in another.
I hear you. Okay, Linda?
Linda Wright, Office of Community Services.
Hi, Linda. Hi, Mary.
I'll do it in a minute. I'll do it.
Mary McLaughlin, you want to?
Mary McLaughlin from AHI. Hey, guys.
We already did Tammy. Lisa.
Hi, Lisa Kutu from Office of Community Services.
And I think that's all. Is there anybody that I missed in that roll call? All's accounted for. Okay, excellent. Just a reminder to everybody, to make this a little bit smoother, go ahead and make sure that you mute your microphones so that it reduces the interferences or people are talking. If you have anything to say, unmute and either speak up or do a raise the hand thing, whatever you're more comfortable with, and I'll try to manage both to the best of my ability. Okay. Okay. So on the agenda for today is to do the agency budgets. Rob, do we have folks present ready to present on the budget?
Yes, we do. I think what we would want to do is maybe Warren County, I believe, has a quorum. So we could approve minutes for Warren County on as indicated on the agenda for the July 9th, 2020 meeting.
Sorry, I missed that on the agenda. I didn't write that down. Okay, so Warren County. Hopefully you had a chance to take a look at the meetings that came in from the last meeting that was 2 months ago. Do I have anyone in Warren County that can make a motion to accept the minutes? Thank you, Joan. Do I have a second?
I'll second.
Thank you, Belinda. Any questions or discussions before we take our vote? All in favor?
Aye.
Is that good enough for roll call, Rob, or do I have to go list name by name?
I don't think we need to for the minutes.
Okay, great. Okay, so is there any opposed to the minutes? Any additions or changes that need to be made? Motion carried, accepted in Warren County. Sorry, Rob.
Okay, then we can move on the agenda. We have Glens Falls Hospital up first for presentation, and Paul Sameka is with us.
Thanks, Rob, and hello, everybody. Our presentation this year will be very different than we've done in the past in that our proposed budget for next year is for the
Motion carried.
Okay, it's for the focused areas of the Crisis Center and our Community Care Coordination Program, so different than in the past. And as folks know, we're in the process of transitioning our outpatient behavioral health programs to Behavioral Health Services North, and Liz is in the group today as well. So we'd be glad to answer any questions related to that. I'll also acknowledge right up front that I'm at a disadvantage because I think, as everybody knows, Laura Pasco, who is my right arm for developing the budget, is currently out on family leave, and she has given me just enough information to be dangerous, but hopefully I have all the answers for you. And so just in terms of background as to where we're at with the programs, our Community Care Coordination Program continues to work to support the individuals who are in the intense community-based care coordination, working closely not only with our behavioral health programs, but also the primary care center. This year, our focus has continued to be on the crisis unit. Our crisis unit has been very, very busy. We've seen a significant increase in both volume as well as acuity as the impacts of the pandemic have continued to evolve. In particular, we've seen an increase in the number of pediatric and adolescent patients who are presenting for evaluation for care, many of whom require an inpatient admission. Yesterday, for example, I believe we had three children that we needed to send for inpatient admission. We certainly think that is a reflection of what's happening in the community, the lack of structure that's available in the schools, which have, fortunately are starting to get back up. We're starting to really work to make sure that our referral mechanisms can be as strong as possible such that we can have and effect a timely placement. In the adult population that we see in the crisis unit has changed slightly as well, in that we're now seeing, or we have been seeing over the past few months, an increase in the number of folks who are presenting with significant behavioral health crises, but have been exacerbated by illicit drug use, with some of the drugs being less than pure, so creating some pretty significant medical conditions as well that we need to manage in the ED before we can attempt to begin to work on the behavioral health issues. So the crisis unit has been, more often than not, has been full. We've had a number of occasions where our 7 beds in the crisis unit are full, and we're needing to hold and evaluate patients in our main ED as we can move folks along. Our inpatient census as well has been significantly increased from what we've seen in the past. That's both a function of admissions from our own area as well as a restriction of beds in the region. Ellis Hospital in particular has taken beds offline. CDPC in Albany have been full on a number of occasions and have transferred patients up here. That creates a huge challenge in that we don't know these patients. They're not known to us. They're not familiar to us. We're not able to I'll answer your question in just a second, David. I never do well with multitasking. But we're sometimes starting from scratch on some patients with whom we have very little familiarity. Yes, we partner with mobile crisis folks whenever we can to use them as a resource to try to balance it, having a first step. So I'm going to stop there. I know we have a lot of background noise, but maybe I can stop there and answer any questions in particular that anybody might have. And certainly, I'm sure Liz would be able to jump in on any questions related to the outpatient program transitions.
So Paul, yeah, my question just was in regards to your ER visits into your crisis center. In order to help decrease some of that volume for people that maybe were able to safety plan so there's not a clog, are you guys, we've been able to work with mobile or with Albany Med, and they actually print on all of their discharge paperwork automatically now. It lists our mobile crisis number, and they encourage people to call us before they get in the car and go to the emergency room or to the crisis services, because we're able to do some diversion. So it might be an idea for you guys to look at to lift some of that pressure off of the ERs in your crisis center.
Yeah, we certainly can look at that. We do run into some issues when patients leave the ED. The amount of information that regulatorily they're required to receive is huge. Sometimes we find them laying in the parking lot out in the street. So if there's more discrete information that we can provide, either in terms of a takeaway card or whatnot, that might be, and as well as putting on the discharge information, that might be a little bit more palatable. We do get concerned that there's just so much information that you need to give a patient to adhere to the Medicare regs. For the simplest visit, it's about 14 pages.
Yeah. If you guys need business cards from us, or I just ordered a whole bunch of magnets actually for people to put on their refrigerator, just reach out to me and I'll get in touch with Jennifer Eslick and make sure her staff get those to you.
Okay, will do.
How much of the increase was the result of COVID problem victims?
It's hard to tell. Anecdotally, our crisis clinicians have said that they're seeing an increase in the severity as well as the incidence. We have people who are experiencing episodic issues related to continuing to be on unemployment, continuing to be furloughed, continuing to have stress in the home and in the family related to children and managing school. The amount of anxiety about the return of school has increased. In general, we've seen, actually, Liz and I were talking about this the other day, we're seeing that population of the more less traditional behavioral health population that's entering a crisis mode. and are seeking out resources, we're definitely seeing an increase in that.
Any other questions from anyone for Paul?
I'm not sure that this question is necessarily for Paul, but I'm just thinking, or I'm kind of wondering if there's anywhere in the county where we're providing some prevention, some or education to families. Like I wonder if there's just kind of taking that more upstream approach, if there isn't some opportunity there that we're just like missing as a.
This is Linda, and that is true for children and youth in the community. There are definitely incline of, as far as need, as far as even care management is concerned, and health homes and connections. However, the resources are limited based on the COVID and what individuals can and can't do. And it's really good for some kids and families for the telehealth, and some kids it's still a little bit of a challenge, especially when you talk about new connections or trying to do respite services and those become a struggle. So we're seeing that across the board. We actually have more referrals in for residential treatment facilities as well as community residents as well. So it definitely is, even in the community supports and trying to wrap around services has been a challenge.
Thanks, Linda.
Just so you're aware, health home care managers, many of the agencies are seeing clients face-to-face using social distancing and whatnot. So if there's a case where you really need a face-to-face and you think that would work better, just let the AHI lead health home know, and we'll make sure we connect with a care management agency that is doing face-to-face.
Yeah, absolutely. Lots more are doing face-to-face now, but I think that's going to be another wave of change as we continue to go through this, and more through the social distancing will hopefully help, and we'll hopefully see a little bit of a decline. But I think that there are significant challenges, and as they said in Glens Falls, I even noticed that there were definitely challenges with kids that are also presenting with not only mental health needs but substance use, and so that is also a challenge when we talk about needing inpatient care or a facility. So those are some of the nuances that we've seen, but there is more in face-to-face as well, but still seeing kids that are I think based on what the hospital was saying, some of the stressors that are there with school and the whole anxiety around concerns about getting that, and some of those phobias now are coming out of not wanting to leave their home, and so those become challenges as well.
And I guess what I thought I was hearing from Paul too is that these are we're seeing more people who weren't connected to services before, and so I guess from that standpoint, I'm just thinking about support to families to help their children get through those anxieties that they might have. I mean, not everyone's going to necessarily rise to the level of needing services, but if we could, focus on that far prevention end of the continuum, just to provide support to families. I mean, I guess I'm just wondering I know a lot of services are being cut. Everyone's really struggling with budgets, but kind of, I remember years ago being involved with like a task force in the county that was doing some community education and mental health awareness kind of things. And I was just wondering if there's anybody left doing that kind of work.
Hi, this is Linda. I know.
Linda, could you mute your microphone? We're hearing your phone call.
There are some task force going that are on there. There are some task force working with the PENS and the school systems and trying to wrap around supports, and they're looking at resources. And so there are some for community-based schools there have been some discussion about that and how we can be more resourceful in using the school population and the facilities there. So there have been some discussions, and I think we're going to continue to brainstorm on those. I think that we'll continue to see new challenges when we talk about children and families. The family support, there's been a lot of work and extensions there as well. And we've actually pulled in Captain's Community Human Services as a resource for respite services and family support and skill building, which is a different, a new piece that we didn't have as a resource, and especially for our non-Medicaid kids, because that has increased.
We may have some resources too through the resource center that I'll share with you, Linda, that might be helpful.
Great, thanks.
This is the other Linda Machad. Can I jump in for one quick second? Hello? Anybody hear me?
Yeah, go ahead, Linda.
Oh, I want to apologize for that phone call. I'm on mandatory, what do you call it? Mandatory, well, I have to stay home. I was exposed to COVID. So, you know, I didn't go very far anyways, but now that it's mandatory, I understand the, how people feel, you know, knowing that you cannot leave your property. So as soon as my isolation is over, I want to make sure I can do something to help people. So whoever needs a volunteer, please contact me, because I know there's a lot of people out there. I'm blessed because I have a brother who can help me. But I know there's a lot of people out there, and I know who I was in contact with. She has no one to help her, and she's 78 years old. So please, anyone who needs help, contact me. I think I'm off the 15th of this month. Anybody, contact me. I will help you. I will get you food, because there's a lot of people out there that need help. Okay, that's it. Thank you. I'm muting.
Thank you, Linda, and good luck as you're going through the quarantine. If there's any way the board can support you, please let us know.
Hey, I'm healthy. Well,
Okay.
healthy as I can be.
Well, good luck.
I'm muting. I'm off Department of Health list, thank the Lord, and just on New York State Tracer. And Paul's on New York State Tracer list too. Thank you.
Okay. Does anybody else have any questions for Glens Falls and some of the things they've been seeing, or, you know, where, you know, their budget is, or what they're working on for Paul? Paul, thank you very much. I know you sparked a lot of really great conversation today, and a lot of back and forth in terms of understanding some things that are going on in the community. I think not all of us have always been aware of as we're going through this. And we really appreciate everything that the hospital is doing as we're kind of trying to work our way through this pandemic. We know this is not easy, so we truly appreciate the efforts.
No, takes a village. Thank you very much. Appreciate it.
Thank you. If there's no other questions, I'd like to go ahead and move on to the next budget presentation. And that would be with Parsons. Rob, is that okay?
Is he saying yes? Okay, there we go.
Okay. And it's to you.
Hello, everyone. David Rossetti here from Northern Rivers, the parent company for Parsons, one of the affiliates for Northern Rivers. The other is our Northeast Parent and Child. I guess I'm here to kind of talk a little bit about programmatic overviews of some of the programs we're providing in your community in Warren and Washington. So I'm going to start with HBCI. HBCI is our program that we provide in-home clinical services for young people who are showing up in our emergency rooms on a frequent basis. And We push into the home for approximately 4 to 6 weeks, and we focus on very targeted behavior to help decrease those visits to the emergency room, and then make sure linkages back to community services have been made. With the 20% withhold, we have decreased our capacity in this program for the time being, with conversation with Rob York and company. So instead of 4 clinicians, we are at 3 clinicians. We, thank God, didn't have to lay anyone off. We had someone resign recently, so we just have put that position on hold, and we are not going to fill that position for now. So we serve anywhere from 9 to 12 individuals at a time. What I'm being told by Kathy Wright, who is our director of that service, is that the minute she puts out that we have openings, she's flooded with referrals, because it's one of those programs that we really don't, they do not encourage us to have a wait list, because it's kind of an in the moment type of a program. The other program that is under Parsons Northern Rivers Northeast is the Mobile Crisis program. We are continuing to operate Mobile Crisis right now, 5 days a week, Monday through Friday, from 8 a.m. to 11 p.m. For children and adults. And then on Saturdays and Sundays, and I always forget if it's 10 to 6 or 11 to 7, so I apologize. But again, it's for children, adolescents, and adults. And we have...
It's 11 to 7.
Thank you. Thanks, Lisa. We do have a group of people who are up in the North Country on Bay Road. And then we have another group of people who are stationed right across the parking lot from me here in Albany, because that program serves Warren, Washington, Saratoga, Albany, Rensselaer, and Schenectady. What we've done in that program over the last couple of years is we've done 2 things. We've removed, during our operating hours, we've removed the gatekeepers, being the hospital or the mental health clinics. We found that, you know, your nursing staff in your emergency rooms, your unit clerks were busy. So they were picking up the phone. People were saying, I'm in crisis, I'm in crisis. They would have to take information. They would have to call us, see if we had a team available. Then we'd have to call the family back, and we were just losing a lot of time. So we've moved all of that to one central phone number. My staff are mastered level clinicians. They answer the phone, they do a triage, and then they determine if we're going to go out for a visit, or are we just going to say, no, you really need to go to the hospital, or can we do some kind of safety planning, even if it's, you know what, we're going to call you back in 2 hours, see how you're doing. So that's been going very well. Our phone calls have been increasing, which is great. We are looking at going 24/7. The 11P to 7A will strictly be telephonic, though. We won't actually be going out during those hours, but we will be triaging calls and doing more of the calling back in a couple of hours, or, you know, can we reach out to you? Or do you think you're going to be safe? You know, can we contract until 7 when I have a team come in, and then we can send somebody out? So there's not a lot of that. Again, people feeling like, oh, I got to go to the emergency room. They'll have somebody to actually answer the phone and work through the crisis with, hoping to alleviate some of that pressure that Paul was talking about in the emergency rooms. The other program that affects Warren and Washington County is our ACT program. And I saw that I have Paige Lorette. And on Paige, I can't see, is that Stephanie with you? Evelyn?
Nope. So this is Amanda, our intern.
Hi, Amanda. So Paige has joined the ACT team about 2 months ago when Owen Alley and his wife had to relocate to another state. Our ACT program is a 48-bed slotted program that works with severely and persistently mentally ill individuals in your community. And they also, they are really treatment without walls. The staff have their morning meeting every 4 mornings out of the week. They plan where they're going to go, who they're going to go see, and then the team gets in their cars and they go out. We really encourage our the clients to engage in treatment where they're comfortable. The 48 slots are full. We do have a waiting list now. In all transparency, we did, again, with Rob York and conversation with Mike Previosa in Saratoga County, we did open up this program a little bit for Saratoga County. After my last meeting with Rob, I sent him some numbers, and the numbers in Saratoga are very, very, very low. Probably 10% of our population is Saratoga County residents, and the other 90% are being served right in Warren and Washington County. That budget, we are not expecting any changes to that budget because 95% of that budget is based on our ability to do billable units or billable services, and that's based on a full month of service or a half a month of service. So we really try to make sure that we meet that full month, which is 6 face-to-face contacts a month that we try to meet with the client. And that might be with the family specialist, substance abuse specialist, the peer, the nurse practitioner, or Paige as the team lead to really kind of, or our employment specialist, to really try and help the client work through their mental illness and then be participating in society as best they can. Kind of look at it as somebody who has diabetes. You need to manage your diabetes when you're working. That's kind of the philosophy that we use with these clients. We also use a shared decision-making process. That's ACT. And I believe those are the programs that are under me for budget purposes. Rob, did I miss anything?
No, I think you covered it, David. Thank you.
Anybody have any questions?
This is Lisa Kutu. I do. Just a quick question, David. Do you have any idea when the mobile crisis might be available 24/7?
So good question, Lisa. So we did post and we're going back and forth. The position is posted because we're thinking of offering that person the ability to work remote because it is going to be a hard position to recruit for. And then I have to figure out, well, what do I do on holidays and that type of coverage? So we are making steps. On the safe side, I'm going to say by January 1st. My hope would be before like November 1st, but to be safe, we all know how things go. I'm going to say January 1st.
Okay, thank you.
You're welcome.
Anybody else have any questions, comments? another group that's really been busy throughout this entire pandemic, and we thank you guys for everything that you're doing for us in the county.
You're welcome.
If there's no other questions, we'll ask, we'll thank you for coming and sharing with us, and welcome in next Addiction Care Center folks.
Great, thank you.
Thank
This is Keith Stack. I'm the Executive Director of the Addictions Care Center of Albany. Karen Carl is on as well, and she is the Director of Operations. I'll defer budget questions to her. What I want to do is just, kind of go over the programs that we provide Warren, Washington County. The women's residential program, I'll start with that first. That opened up, we had our open house on December 11, 2019. We admitted our first client on December 28th, 2019. It's a 16-bed adult women and 2 beds designated for children. It's a stabilization, rehabilitation, substance use disorder treatment program. By the end of February, we had 13 residents, adult residents. We didn't have children yet at that time. We were pretty, excited about that occupancy rate, how well the program was doing. Then COVID hit. Similarly to our women and children's programs here in Albany, we rely heavily on a functioning family court, other human service agencies that interact directly with women and women with children for our referrals. And those systems really closed down almost immediately in March and April. Family court in many ways still is not functioning as normal. So our residency there dropped off quite dramatically, and I had several conversations with Rob York about this. At one point in June, we had 1 resident in the building. I'm happy to say that the numbers are picking up. As of tomorrow, we'll have 8 adult women in the building. We're now talking with, I believe it's Warren County probation, about a woman who's actually 35 weeks pregnant, unfortunately still using substances, and figuring out what her next step is going to be. But ultimately get her into, our women and children's program. So, we're actually happy that we're coming out of the other end of COVID relative to that program. We have a funding for the jail-based treatment program. That funding began last year in 2019. Because of the sheriff's election in Warren County, it was very, very slow to get off the ground. Then it turns out that the Warren County Correctional Facility has I won't say fairly, I should say very comprehensive health services contract that included behavioral health care services. So, we're in the process of linking our mobile recovery unit to the jail program, and kind of transitioning our original thought on jail-based treatment, linking it more directly to people being released from prison, linking our mobile unit directly to them, and then directly to any necessary services, even besides substance use disorder services. Issue with jail, we have 3 jail-based programs, one in Rensselaer County and in Albany County. The issue with jail-based programs is they're not allowing outside entities in just to manage COVID. So that's, the status of that program. We have a contract for a 20-bed men's stabilization and rehabilitation program. We're, I would say, 6 to 8 months behind on that project because of COVID-19. We did purchase 68 Quaker Road on June 19th of this year. So we're in the process now of the design work for the program, and we're using Architecture Plus out of Troy. They're designing the project based on the original feasibility study and also developing the bid documents. We anticipate to get those documents from them by the end of October. DASNY and Oasis will sign off on the bid documents. My hope is that we put the project out for construction bid in December, begin construction, February of 2021. It usually takes, it's a very good building. So it's, the construction work is all inside. So it's going to be a renovation. Basically will be gutted for the most part, and then new heating system, new mechanical, electrical, but then reconfigured as a residential program. Our experience at 79 Glenwood and a couple of other similar projects, it takes about 8 months from the start of renovation to a grand opening. So we would anticipate, in the fall of 2021, opening up that men's residential program. And again, set back a little bit by COVID. We're actually, because we had a contract with Oasis, a capital contract with Oasis already in place, approved by the state controller's office and the state attorney general's office. We're fortunate enough to be able to continue with that capital project. Many capital projects that were in the planning stages but weren't under contract yet just aren't happening. So we're glad we're in that situation. We do have the Oasis SOAR project. It's a state opioid response program, and it's called CODI, Center for Treatment Innovation. That's funding that comes through the Mental Health Research Foundation. We've been operating that since last fall. The funding for that ends September 29th of this year. So basically, we have a mobile unit that goes through Warren and Washington County and provides peer support services and provides access to medication-assisted treatment. And, again, that was affected by, that was a mobile program. COVID suddenly turned it into a non-mobile program. We have approval for telepractice, telehealth. So we, went in that direction. Things have eased a little bit. The certified recovery peer advocate we have in the area is able to transport individuals to necessary places, whether it's our, one of our residential treatment programs, to a hospital, or other human service. Our goal for that program, when we first applied for the funding, we had to develop a sustainability plan for that program. And our sustainability plan was to absorb the staff and those services in our 2 residential contracts, so that the staff would be able to work in the residential programs, but they would also be able to continue to provide community-based services on a mobile basis to individuals that were discharged from our program or discharged from another substance use disorder program in the area, and provide continuing care and medication management. That's actually still our intent. There was a email distributed by Oasis about 3 weeks ago where they were reaching out to the federal government and requesting the ability to continue funding the projects statewide beyond September 29th, because many, in our case, there's still funding available for us to claim. Projects, most projects started later than, expected. And then there was a slowdown with COVID. So we weren't, claiming all of the funds. Today's what, September 10th, and we still haven't heard from Oasis whether their request was approved or not. Our goal still is to absorb those mobile services into the residential programs and be able to provide, mobile community-based continuing care to individuals. It's interesting. It really has turned in, particularly because of the COVID situation, into a harm reduction program. We have been able to introduce, a good number of people, introduce them to medication-assisted treatment if, in the event they're, addicted to opioids. That's been a very good aspect of the program. One of the shortcomings has been then convincing people to continue with treatment beyond just the medication aspect of it. Those are things that we continue to work on. The program's really just a year old, and it's transitioning. It's in the process of transitioning. So again, we're happy to see that the women's residency is picking back up. We've always, we've been able to maintain the required staffing in that program. We actually had a meeting today to look at adding some additional case management staff because the numbers are picking back up again. And we look forward to progressing with the men's residential program this fall and then through next year.
Does anyone have any questions for Keith?
Were you all not able to hear?
No, we weren't able to hear that, Rob.
Oh, sorry.
Joan Grishcott had asked a question. How many people are being served in our counties in the ACCA programs?
Well, there's currently, as of tomorrow, there'll be 8 women in the residential program at 79 Glenwood Avenue, and we have 12 active clients in our mobile recovery unit program. We've 12 active clients. We had been, we've served others that have, they're either in a treatment program, could be Conifer Park or another program, but currently 20.
And Keith, we can continue then making referrals to Joe.
Yeah, absolutely, yes.
Because I know that many health home care managers have really appreciated those services being available.
Yeah, I think it's made a good connection with the emergency room, Glens Falls emergency room as well. So, yeah, and, again, a lot of the early work was outreach and just, getting Jeff Torres and then Joe Cavallo out in the community, trying to explain the program, making those connections. But, and, So that's been working, and being able to connect a heroin addict with medication-assisted treatment as a means to start the recovery process, very beneficial. And these are individuals that frankly normally might not find their way into the system, but certainly with the COVID shutdown wouldn't find their way into the system.
Any additional questions? Thank you very much, Keith, for coming and sharing with us. We know how busy you guys are during this process too, because we know what's been happening with all the COVID and drug use. So thank you so much and for coming and sharing with us today.
I just want to say one more thing, and I said it at the last meeting. Queensbury has really been excellent to work with as a community. Getting the, typically it's very difficult to get a residential treatment program approved. Queensbury actually has a zoning district, their C1 zoning district, and the language in it seems like it was virtually lifted from the OASIS website describing residential services. So, the community has been very helpful and very welcoming to us. So that's a hurdle that we didn't have to overcome. And we're able to find two really good buildings in that particular zoning in Queensbury.
That's great to hear. It's nice to hear that went so well. So thank you so much. And thank you for all that you're doing for our community. Really appreciate it. Okay, next up we have People USA.
Okay, hello everybody. This is Steve Michio. I also have my CFO, Amy Zhang, here too. And the Rose House has also been hit with the COVID. We had to shut down for a while because we did get hit with it. And we were working virtual, running the warm line, doing a lot of outreach in the community, the people that were former guests, staying in touch with them. We ran a bunch of virtual groups from our Poughkeepsie locations, as well as up in Glens Falls, so that people had access to different types of groups, and we advertised that heavily with the people we serve. We also, we're open now for business. We've had guests coming in, and it's been relatively busy. As you can imagine, the COVID has affected people's state of mind, and it's been very challenging for folks. So it's been going well there. We're also in the process of moving forward, and this isn't part of our budget because our budget remains flat and is fine for 2021. But we're moving into Health Home Plus, where we are investing in staff to start that program with us. And we've gone through the certification process to provide that service, because what we noticed when we were doing the transition of care work at the hospital, that a lot of people qualified for Health Home Plus services, and we want to be able to provide that as well. So we're just moving very slowly into that service as well. But overall, the work we're doing in the Rose House has been constant and steady.
Questions from anyone in the group?
Yeah, what is Health Home Plus? What does that entail?
Health Home Plus is a more intensive case management. Remember the legacy case management? You had case management and then intensive case management. It's more of an intensive case management model where you get more face-to-face time and provide more service to the individual.
Excellent.
Thanks.
Anyone else? I really like the way you guys used some creativity around continuing with groups and those points of contact with folks as they went through this, because this was a very difficult time for a lot of folks that I know use the services there. So
Thank you.
Really
It
appreciate
was.
that creativity.
We're continuing the virtual too, and so that's still being used quite a bit. We get to see the outcomes in our Zoom reports, how that's going, and it's still pretty busy. So we're going to continue that going forward.
Wonderful. Anybody else have any questions for Stephen about what they're doing over at Rose House, their budget, anything along those lines? I hear silence.
All right. Well, thanks.
Thank you so much. I really appreciate you coming by.
Thanks.
Thank you. Okay, everyone. So Rob, if I'm not mistaken, those are the four that we're able to hear from today.
Yeah, so just for information for the board, our budget, the Community Services Board Budget Review Committee met this summer, met with all 8 of our contract agencies and did vote to recommend approval of all the budgets. Usually at our September meeting, we do have the agents, or the September meeting, we have the agencies come through and do this sort of a presentation. We had some other business to do today, so I thought we would break it up into 2 different meetings and do the other 4 at the October meeting. So that's why the agenda is structured the way it is. We also want to cover our local services plan, which was delayed a bit this year and is required to be submitted this month. So we want to cover that in this meeting as well.
So that, Rob, the agencies that have presented today, is it necessary for the full board to be able to vote on what we've heard today for them? Or can it wait until next month when we hear the remainder of the agencies?
It could wait.
Okay. Okay. Excellent. Does anybody have any questions or anything about the agency presentations that we've heard so far that we would like to discuss before we move into the new business? Rob?
Kim, maybe just a suggestion too. Maybe we would want to reorder the agenda just a bit to allow Liz Cole, if she wants to provide her update now, just in case she has to drop off before the end of the meeting.
Okay, that's fine unless there's any opposition to that. Okay, then why don't we go ahead and do that? Why don't we move over to the updates there for them to share with us their updates, and then we'll move over to new business.
All right,
Liz?
great. Thank you. So just to give kind of an overview of where we are from our state regulators, we are moving. We're a little bit closer on the OASIS side of receiving our license. A few weeks out probably on the OMH side. So we're hoping in the next week to 2 that we have both in hand and we can really start our process for implementation. Staffing, we are in currently transitioning over the team. So we have started the onboarding process for that. So we're excited about that and have had some really great meetings with the Glens Falls team. Continuing to finalize space for the Warren and Washington County. We were just down here this week looking at a few more space opportunities in the Washington County area. So that is where we are on a spacing. As we move through really the next couple of weeks after we get our licenses, we will kind of have more concrete dates, hopefully, for our implementation date, as well as hopefully some community partners, open house events, whether it's in a virtual platform due to COVID or not, but really starting to connect to the community partners in the area to assess need. We also today are going to be, and Rob, I don't know if you want me to go ahead kind of and present a little bit about school-based. So many of you know BHSN has a very robust school-based program in the Clinton County area. We are in communication with a few school districts looking to pilot our school-based mental health program. We currently have started the process with 3 local schools. So kind of presenting on that today, looking at starting between 2 to 5 days in the schools. And obviously the need is higher than ever before. So once our application goes through from OMH, we will be applying for an additional satellite certificate so that we can get into the schools and help support some of our local districts, as we know they have a very difficult year ahead of them. if anybody has any questions. I know I just gave a
Yeah.
lot in a very
Do you know
short period of time.
what schools you've been talking to?
Yep, so we are currently moving and going to be applying for satellites with Glens Falls City District, Salem, and North Warren.
Okay. The only reason I ask is I'm the district superintendent of the BOCES, and we have quite a few of the contracts that come through us so they can be aided for the school district. So I didn't know if you knew that or not.
No, Rob and I have actually had some recent conversations just about trying to kind of connect and touch base a little bit more, get more familiar with kind of the operations of the superintendents in some of the school districts. So maybe that's something we can connect on.
Rob can help you out with that, but my guess is if that's the service they want, they may want to go in that direction.
Jim, I thought maybe it would be a good idea if she could attend one of the superintendent meetings that we hold with the county. One of the upcoming meetings.
Yeah, I'd be happy to. Any questions? So we've moved really quickly. It's been a whirlwind, but we're really excited to keep the process going, and hopefully we're looking at a beginning of November start date. It keeps getting pushed. We're really hoping that the states flip their applications quickly, but looking at right now a November start. Been working very closely with the hospital. As we really get into the details after receiving the licenses, we'll work with with the clients to have warm handoff in the smoothest process between locations as much as possible.
And Liz, have you run into any kind of major barriers or any problems, anything with systems or anything that is a potential thing that we need to be aware might be a problem?
No, we're just, like I said, we're at the mercy of the state right now. OASIS has actually, moved a little bit quicker. So we're kind of waiting on OMH as they're going through, the review process. But we're really, with the training schedule and an implementation schedule, we really have a very concrete plan. So hopefully it's smooth after this. Knock on wood, we know we'll hit some bumps, but for the most part, it's been a very smooth process.
Exciting. That's good.
Liz, I really appreciate all your work on it. I know it's been a lot.
Well, we're happy to be coming in, and we got a great team to be working with. So we're really appreciative of that, and we can definitely feel the investment from the counties. So that makes a world of difference.
Great.
That's excellent. Any other questions, folks? Well, we look forward to hearing from you next month and see how things continue to go. Fingers
Yes,
crossed.
hopefully we're even farther in the process.
Excellent. Thank you so much, Liz. We really appreciate you being here today.
Thanks so much.
Thank you. Okay. If there's no other questions, we'll turn it over to Rob with the new business.
So I think we were making the decision to hold off on voting, right, on the agency budgets. We'll just do that at the October meeting. We'll do them collectively at that meeting. The other thing on new business is our 2021 local services plan. And Carrie Wright has been working on that and getting it entered into the state system and everything. And she worked together with our intern this summer, Darby Larkin. And they put together a little PowerPoint presentation on it. And so I'm going to turn things over to Carrie here. If you bear with us just one moment, because we've got to figure out how we pull that presentation up and then share the screen. So now I need to pull the Zoom back up, right, and share screen. Okay, are folks able to see? Are you seeing the PowerPoint?
It's still loading, but it's getting there. It is. Yep.
Okay, then we want to go to the slideshow, right? X out of this. Okay, we're going to switch spots here, and Carrie is going to walk through the PowerPoint.
All right, thank you, everyone. So I will go through this relatively quickly so that you can be out of here by 4:30. As you know, the local services plan is due every year. Typically, it's due in June. However, due to the pandemic, we did have an extension. It was also, this part is mandatory. They sent out a COVID survey that was sent to stakeholders in our area and sent directly back to CPS and the staff at OASIS that are responsible for the county planning system. So they really focused more on the pandemic and the effects. So we did our best. We sent out a survey. Darby, our intern, did a really nice job formulating some survey questions. We got a lot of great responses back from community agencies and stakeholders around some gaps in services. So we did the best we could. Obviously, there's a lot of things that are in play right now that are going to affect how services are delivered now and in the foreseeable future. So we will move forward here. Let me see if I can get this. Oops. All right, bear with me. I'm like not it down. Okay, here we go. So we compressed some of our larger goals from last year. We have 7 goal outcome topic areas. I won't go through all those right now. I'll just do them one at a time. And our first priority goal was the integration. Oh, there we go. And coordination. Let me move you guys so I can see. Across the 3 disability areas and among local stakeholders. One of the things the survey provided back to us is a lot of feedback about the need for better integration, which we're aware of, but certainly with the pandemic, it really highlighted the need for systems that may typically not have worked together to come together in a more cohesive way. So let me see if I can scroll down here. How do I? Okay, sorry guys. Like, so I can read the whole thing? No, that's not. That works. All right, thank you for your patience. So like I said, through this survey, it indicated a high desire for more integration and coordination across the disability areas. Obviously, you know, we talk about population health and whole person health, but our systems are still very siloed with the state oversight agencies. So trying to figure out how we can do a better job of working together was a lot of the feedback that we received. So for our first objective was to improve integration across these structures with the stakeholders, with the implementation of services throughout both counties. And part of this can be done with the mental health and substance use subcommittees. If we can try to determine or figure out how we can get some smaller working groups together with some actual, you know, actionable objectives that we can work on as a community. Darby and I obviously can't do all this alone. This is a whole community job to look at how to implement these changes. The second objective is to improve integration with the community and community services for justice involved individuals. I co-chair the Criminal Justice Community Services Task Force along with Allison Reynolds now from Hometown versus Heroin Coalition. We combined those 2 task force because we had so much of the same participants, and it really made sense to combine those 2 efforts, especially talking about integration, right? We don't need just one task force that's doing all this work strictly on heroin. It's a much larger issue. Substance use, alcohol use in our area is really one of the largest problems and continues to be. I'm sure you've seen that throughout the pandemic, that was a service that had to stay open, right? Liquor stores had to stay open because we recognized, although no one said it, that if you close down liquor stores, the people that would be detoxing, it would be tremendous. So we really felt like the criminal justice and the work of Hometown versus Heroin would be best combined. So we're doing that now. We've been meeting monthly again. So if anyone's interested in that, certainly send me an email. We can add you to that list, even if you just wanted to get the meeting minutes just to stay apprised of what's happening. So again, we talked about how we could include probation, jail employees, trying to figure out how to get more recovery services in the jails is also super important right now. And we also worked with PRA, which is a group that is our local SAMHSA. They have a GAIN center, which works really with the criminal justice, mentally ill, substance use population. So they've been a great resource as well. Objective 3, support and normalize the use of New York Connects. New York Connects is a great resource. So many stakeholders responded that they don't know how to, get services or where to have like a central kind of resource to access a lot of different, food pantries, substance use services, mental health services. So really to try to promote the use of New York Connects instead of trying to reinvent the wheel. There's already so many different hubs and resource centers. Printing out a paper booklet is no longer really an option in 2020. The services change so quickly. So really to focus on that as a objective. Objective 4 is to work with the North Country Regional Planning Consortium. Rob does much more of that work. They're really a direct link to our state oversight agencies to kind of filter through any major concerns or issues that are happening in communities regarding the 3 oversight agencies that we are responsible for the provision of services. So Rob continues to work with the RPC. I'm not directly involved with them. Priority goal 2, this is always really the one we hear the most feedback on typically, is to increase access to flexible behavioral health and substance use services. We're very hopeful now that with BHSN, they are looking to not only take over those services of Glens Falls Hospital, but as Liz just spoke to expand those. So obviously we need a continuum of those services and supports. David also just spoke to this, that we would love to see the expansion of mobile crisis to 24 hours, 7 days a week model. That's really also become an issue with police departments needing additional help and support in how they're dealing with mental health clients and substance use folks. That's really been, I've gotten a number of calls from local police departments about their concerns, obviously with the climate now and, some of the movement to defund the police, which is not really a easy, quick answer, but to try to figure out how we can better deliver services so that the police aren't acting as mental health professionals. Objective 2 is to expand the availability and outreach of substance use mobile treatment services. Keith Stack also just spoke to this. They're the provider of the mobile, the medication assisted mobile treatment, and also trying to get them connected with Warren County Jail, as he spoke to, is another focus of mine. We're trying to reestablish our relationship with Warren County Jail. That sort of fell apart a little bit during the pandemic, as everyone was just busy trying to maintain. So we're really looking to expand those services. Joe is the program director of that, and he is going to be doing, I think, some more outreach now that things are sort of starting to get rolling again. Objective 3, exploring new opportunities for services in the school districts. I'm not sure, are the other clinics still operating, Rob, or planning to in the school districts that were already? Yeah, so to continue to expand that, that's going to be the best place for many children to receive services are the days that they're in school. Many people are also doing hybrid options, but that's just an opportunity for folks to get the services they need, especially kids that may not have had the support at home during all this time. Objective 4 for increasing the access is additional opportunities to look at screening in pediatric and primary care settings, to utilize our primary care offices to refer kids to other, linkages within the mental health services and recovery services. Objective 5 is the expansion of outpatient behavioral health services for the SPMI population, which I just spoke to with BHSN. Again, they're really looking to not only transition their services, but to expand on those. So that's very exciting. And they have an integrated model. They are able to provide all those services in one spot instead of segmenting and having, folks go to a wide variety of agencies for different services. So that will be helpful. We're very excited about that. And also to focus on the open access model of treatment. We're not sure, what that will look like. That could be more telehealth related since clinics are open, but, we're not sure what's going to happen with the pandemic again. I know there's still some concern about second wave, so open access and face-to-face treatment is still sort of being ironed out, but we would like to be able to see some expansion of that open access model, allowing folks to come in when they need services rather than make an appointment and then have a no-show rate. The no-show rate is much lower when folks are able to access services when they need and have the desire to get them. The third goal is also pretty pertinent right now, is obviously to expand telehealth opportunities across the disability areas. I've been in touch with Katie Cook through AHI, who runs that program, the telehealth. And I know she's coming to our subcommittee meetings, I believe, to do a presentation, but to really use them as a resource for agencies that may be a little farther behind on telehealth, to figure out how we can provide services for people more easily. And the pandemic has really only made that we're all acutely aware of the need to provide services in a new way. So that Darby put in a little note about the survey conducted that 72% of the respondents indicated that they would like more information or training on telehealth, and they would be open to offering services to the community. So that's exciting to see. Also to expand telehealth, to see if that's an option, throughout local schools. It sounds like some of the schools indicated telehealth is necessary in addition to what they're already providing in the schools as well. And that the service intervention involving children has greatly increased since the beginning of the pandemic. Linda Wright from our office spoke a little to that, the obvious need that we've seen in substance use in children and the mental health toll that it's taken on really everyone, but certainly kids as well. The third objective, explore options and opportunities to expand telehealth services into local jails. I know Warren County Jail does have the capacity to provide telehealth services. Last I spoke with them about it, they weren't really utilizing it. So some of the issue of getting it up and going is that there's really just more of a cultural resistance to it. People may have the equipment, they may have the capability to do it, but trying to get folks to see the value of it and engage in it has been a little harder. So I will continue to work with the jail and the sheriff's department on determining if there's a way to provide services there, particularly since there's so many restrictions on providers coming into the jails now. Washington County is not letting anyone in. They're restricting a lot. They have Lisa Thornton who works in there, who does a lot, but Warren County will allow folks in. So we're looking to work more with them, just makes more sense right now. And priority goal 4, promote and aid the growth of peer-delivered services. This was also in there from last year, but to expand the use and resources for peer advocates and peer-delivered services. A lot of our criminal justice and community services task force sends out the SERPA, which is the peer advocates for OASIS. There's a variety of different places that certify peers. So we're trying to get information out about that. Baywood is doing a recovery coach academy. So we just emailed our listserv all of that information, but really to take advantage of opportunities to deliver those services. Peers are a great way to get through to folks that may typically not be interested or not responsive, to what we see as traditional treatment. We've also developed a really good working relationship in Warren County with our Warren County Employment and Training Office. They do have some funding, or did, at one point, I'm not sure what that looks like right now, but to possibly pay for scholarship opportunities for individuals that are interested in becoming a peer. It's a pretty intensive process, and it costs not a decent amount of money for folks to invest that time to become a peer. So there's some barriers. And so I have had some conversations with them about the possibility of paying for those services, and they're open to that, or that training. Objective 3 would be to continue to coordinate with our local recovery centers to disseminate information on those opportunities and scholarships for peer certification. And that can just be, again, just getting the word out that these trainings are available, and then also identifying folks that would be interested and well poised to continue and actually complete the certification process, because again, it's pretty lengthy. Our 5th goal would be to improve coordination and access to housing services. Housing always continues to be a major concern across all the disability areas. And according to this 2019, the CHA data, Warren County has a 11% poverty rate and 24% ALICE rate. ALICE means asset limited, income constrained, employed. So those folks who are working but are really living paycheck to paycheck. And I think it might actually even be a little higher than that. You can look up any of the ALICE information online. The United Way puts out that report, but it's pretty eye-opening if you haven't seen it. So objective 1 is to try to coordinate a meeting. It doesn't have to be all our state oversight agencies, but maybe our local, field offices, their representatives, and our local providers, just to promote some information sharing and better communication about options that are available in the area, and to have everyone at the same table rather than one state oversight agency and that particular provider. Objective 2 is to continue to support any options financially that may come out from the state to increase the number of affordable housing units in the area that are safe, affordable, and person-centered. There are some new units that are income-based on Broad Street. If you have not seen them, right across from Hannaford, I did just send out, I believe, our local continuum of care, which is our housing meeting, did just send out some information about that. So also, if you have any interest in that, I believe they're taking applications. They don't expect the actual building to be done until December, but that's good to see that coming up. Objective 3 is to expand and normalize the use of coordinated entry process. We now have a paid coordinated entry person for both our Saratoga and North Country continuum of care through Captain Shelter. So they have someone, and the coordinated entry process is similar to, I don't know if you all remember or are familiar with like No Wrong Door. It could be someone coming into any agency. There's a really basic coordinated entry application, which then places and scores individuals that are in need of housing on one centralized list. And then the person that's hired through Captains has access to that. And based on a person's vulnerability score, which is determined on a number of the questions in the application, those individuals come up and they reach out to try to hook them up with the most appropriate program. So coordinated entry is HUD required. It's taken a number of years, probably about 4 years, to really get it up and running and to be effective, and to have a paid person doing it. Prior to that, I was the coordinated entry person, then Linda Wright was, and really it's a full-time job. So that's exciting to see that we have a paid Warren, Washington, Saratoga, and Hamilton County. Yep. Goal 6 is to encourage the systems of care model and wraparound services. Linda Wright could speak a lot better to systems of care. If you have any questions, I've worked with her a little bit on it, but systems of care is a model. It's not, you know, a program. So not to be confused with an actual program. Objective 1 would be to develop a systems of care framework to form communities that engage in problem solving and sharing of resources across systems to impact the best outcomes for children, youth, and families in Warren and Washington counties. And it could involve encouraging greater communication, coordination, and advocating for institutional level change that would allow and facilitate this kind of network building. So similar to what Amy spoke to, systems of care is really bringing in not only our stakeholders and our agencies that we consider the experts, but utilizing those natural supports that we may not have typically worked really well with. That I think, again, COVID has really highlighted the need for government and agencies to work with what already exists in the community, whether that be, you know, local churches, food pantries, places that may have eyes and ears that interact with our children that we don't necessarily think of. So really kind of looking outside the box to see what natural supports we have in our communities and engaging those folks to help us out and make sure that we're able to identify those that are most in need. And systems of care is for children and youth. So objective 2 is to utilize the systems of care framework in the implementation of community collaboration. It's really a model of shared values and principles across all services. So really it's about engaging, assessing, taking some action, and then monitoring after that. Linda indicated that this broad objective would move us closer as a community to the coordinated network of providers and services envisioned by the systems of care model. So we have oodles and oodles of information on systems of care, again, for anyone that might be more interested in, you know, delving a little more deeply into that. Oh, I think I inserted that accidentally. I did. Well, this was an objective that we added to systems of care. Forgive the heading. I just forgot to change increase access to systems of care. But part of the systems of care would also be to support current transportation programs. We used to have this just as a goal in and of itself, but really transportation fits among all these different goals. But to focus on Uplift, they are still functioning right now. Uplift is a program through Baywood, but also to figure out some other alternative transportation options. The last goal is to facilitate cross-training and continuing education for service providers and local organizations. The survey indicated that cross-training was a high need for all of the services and all of the community stakeholders that responded, especially within the justice system. That was really highlighted. We asked some questions about police interactions for folks that work in our agencies and the recipients that they serve. So for the first objective would be to explore options for regularly scheduled and repeating trainings and trauma-informed practices, whether that be crisis intervention, which could be for local police departments, probation, juvenile-driven agencies really, and de-escalation for law enforcement agencies. More than 90% of the providers that were polled in the survey indicated that negative interactions with law enforcement because of lack of understanding was a problem for those with mental health and substance use issues. And that's no, you know, I'm certainly not blaming the police at all for that. We're asking police to do a job where they get 40 hours of training that a licensed mental health person is providing after, you know, 6 years of training. So we're really putting them in a terrible position in a lot of ways. So Adirondack Health Institute has run a crisis intervention training. We've put on a few for local law enforcement and jail and probation that have participated. Unfortunately, many of the police officers that have participated, I think there was at least 3 or 4 that completed CIT and then left. And it's a pretty intensive training. It's a week-long, you know, a full-time 9 to 5 week-long training. And so to train folks and then have them leave is is really tough because it takes a lot of time and commitment on the police agencies' part to send those individuals. Objective 2 would be to create connections to support the creation of some sort of continuing education for local magistrates. Our office is working with Washington County right now to do that. I am meeting with Mike Gray and the Washington County magistrates later in this month just to go over a little bit of trauma-informed care, the criminal procedure law, the things that many of the judges run into when they see folks that come in with mental health and substance use issues. So we're just going to do a really brief PowerPoint with them, and hopefully we'll be able to continue that in Warren County as well. Just about local community services, and really the courts, similar to the police, end up being a receptacle for many folks with mental health and substance use issues, and it doesn't always get handled in the best way. So we're hoping that that will be a good training and be well received. Third objective is to encourage the sharing of training resources between providers. I've talked a little with Allison Reynolds about this from the Council for Prevention to try to figure out if we could even keep like an Excel document, something simple with all the different trainings that are available, so that we could point to ourselves as, you know, if someone is looking for a particular training or CIT or the different programs that the council puts on, we would kind of be able to keep that up to date on what is currently happening. I'm sure you guys have seen, and one of the biggest issues I came across during the pandemic was that I had no idea who was providing what at any given time. It was really hard to keep track of that. So that would be super useful. There's some quick data if anyone wants to take a look on where some of the information came from. Ooh, and I ended right at 4:30. So thank you all for your time and attention. I'm sorry to ramble if that was too many words, but if you have any questions, certainly let me know. You want me to click out of this? Stop share.
Thank you, Carrie. Does anybody have any questions for Carrie about any of that? There's a lot of work you guys put into that. Thank you.
So we would.
Any other? Go ahead, Rob.
We would like to take a vote on it once you entertain any other questions.
Okay. Any questions from anybody given the plan or the priorities that they laid out? Going once, going twice. Did Joan have a question?
Joan has a question.
Rob, can you repeat the question too? We can't hear that online.
Sure. Sure. So Joan had asked the question whether it's available in print, and the format that we put it in the online portal is not a user-friendly, kind of thing to read through. But there is a way that we export it and we post it on the county websites. It's also on the Conference of Local Mental Hygiene Directors website. And we can certainly print copies for anybody who's interested.
Linda, did you have a question?
No.
No, okay. Anybody else have a question? Comment? Excellent. Okay, so then we need to go ahead and vote to accept that local services plan in so that they can submit that this month. We'll do that for Warren County first. Do I have anybody from Warren County willing to make a motion?
I'll make the motion.
Thank you, Jim. Do I have a second?
Joan seconded.
Thank you. Excellent. So we're gonna need to do a roll call on that.
Yes, please.
Crystal, do you have the names of everybody that's there? I know we got Joan and Jim, Maureen.
I'm not sure if Crystal's on. I can go through the names that I have.
Okay. I see
Okay.
Maureen.
Yes. So we have a yes for Maureen.
Yes.
Belinda,
Yes.
Kim.
Yes.
Kim's a yes. I think we lost Holly.
Jim,
Did you say Jim? Yes.
Jim.
And then Joan.
Is Amy still on?
I think we may have lost her too. I don't see Amy.
And Joan Grishkot is here. So that's 5, and we still have a quorum in Warren, so that's a valid vote. Thank you.
Over to Washington. Do we have a quorum there?
I don't believe we have a quorum.
Okay. Okay, so then we'll put that on the agenda for next month and for Washington to vote for both that and the minutes. Yes?
Yep.
Okay,
We will,
excellent.
we do have a due date on the plan, so we'll go ahead and submit it. But if Washington County had any concerns or felt that something was omitted, we have the opportunity to, submit like an addendum comments.
Excellent. Good. Okay. Well, if there's no other, is there any other announcements or anything anyone wants to share before we adjourn for today?
I just had one question. This is Michelle for Washington County, because I know it seems like we have trouble getting quorums often. But for those of us that are here, can we voice our vote? I know just to have on record for in case next time there isn't enough.
Right.
Or is that not a legal way to do that?
Sure, you could go on the record.
Did you hear me?
You could go on the record, I suppose.
I can't hear you now.
Yes, I think you could go on the record with your opinion as to whether you support it or not. Sure.
So I would say yes for me.
Well, first of all, don't we have to approve it? Hi.
You know what, I'm realizing that with Mary Alice in the room, we do have a quorum, so my apologies.
So would you like me to do a vote for Washington County?
Sure, I mean, I have, yep, go ahead, Heather.
It's got to be approved.
You can run through a roll call.
And I have a motion for Michelle for Washington County. Is there a second motion for Washington County?
Mary Alice seconded.
I can't hear.
Mary Alice seconded.
Okay, thank you. Any discussion? Should I go around and have everyone from Washington County? I can't really see who's here on my screen.
I can run through the names if you'd like.
Yes, thank you.
So Heather,
Yes,
Tammy,
Yes.
Linda,
Yes.
Michelle,
Yes.
and Mary Alice. Mary Alice was a yes. So that is also a quorum and a valid vote. Thank you.
Anything else from anyone else?
would you like me to approve the minutes for the July 9th meeting since we have quorum?
Yes, that would be good. Thank you.
Can I have a motion for the July 9th meeting minutes for the Community Service Board?
I'll make a motion.
Thank you.
I'll
Michelle.
second it.
Thank you, Linda. Is there any questions or any further discussion? All in favor, say aye.
Aye.
Aye. Motion carried.
Thank you.
Do anything further that?
No, from my perspective, I think we're good. Just a reminder that the next meeting is Thursday, October the 8th at 3 o'clock. And it will also be via Zoom and broadcast on YouTube.
Thank you, Rob. Thank you, everyone.
Thank you.
Thank you.